No, the hair works. The hair works much better on you than it does on me.
Today, my guest is Professor Robert Dingwall, who sits on various COVID-related government advisory bodies and has been described as one of our most humane and compassionate commentators on the pandemic. As a professor of sociology, an honorary member of the Faculty of Public Health, Professor Dingwall has a broad view of the impact of the disease, together with the collateral costs of the UK response to it. He believes coronavirus should not just be seen as a viral challenge, but also a societal one. If you're interested in these podcasts, please like and subscribe. We have plenty more guests coming up. Last January, I rang you up and we had a discussion about a novel virus that was worrying people a bit, had been causing deaths in Wuhan. And I rang you up to ask you about that. I don't think either of us would have ever predicted that we'd be having this conversation here now. I mean, you've played a key part in sort of decision making and the response and helping the media understand the virus. And as a leading sociologist and someone who understands a lot of different disciplines as well, what do you think, looking back, what do you think has gone wrong and what else, how can we avoid the same mistakes again?
Well, Lucy, I rather found myself in this role by accident because I'd been appointed to a committee called NERVTAG, which was set up in 2016, 2017 as a horizon scanning committee. And most of our early work was sort of receiving reports of exotic strains of flu in Chinese ducks and trying to work out whether they represented a hazard to humanity, I suppose. And that meant that we received this report of this mysterious new virus in Wuhan just before Christmas 2019, and sort of fell into a role that I'm not sure anybody would ever have appointed a sociologist to, thinking about, well, what are we going to do about this this new virus, which appears to be quite contagious and appears to be killing a lot of people. I think over the last 12 months or so, what we've come to see is that really the scientific advisory apparatus that was created for dealing with emergencies, for short-term emergencies, floods, weather events, major accidents, terrorist events, possibly sort of short-term infectious disease emergencies, hasn't really been fit for the long haul.
Just going back, what were the discussions at the time? Were there discussions around, you weren't involved with the early discussions about how we were going to plan our response to this, or whether we locked down or not? Was that part of, what you discussed in NERVTAG, or was it nothing to do with it?
No, that was really all very much above my pay grade. I mean, NERVTAG sort of fell into the orbit of SAGE, really, without much thought, really. So NERVTAG was asked to take a view on the nature of the threat that the Wuhan virus presented, which was its proper job, and then acquired all of these other functions as a standing group on the sort of lab science of the virus, and to some extent the public health and epidemiology of the virus, without having the sort of specialist mandate that either SPI-B, which was the behavioral scientists, or SPI-M, which was the modelers, or environmental modeling, which is largely the engineers. NERVTAG was sort of doing all the bits that weren't covered anywhere else.
What do you? Sorry, I interrupted you, but you said that the emergency apparatus that we launched then is not really something that's sort of fit for the purpose now. Is that what you meant? Can you expand?
Well, this is something that Gus O'Donnell has been saying, the former head of the civil service who devised the system in the first place, that the problem in some sense is that SAGE is fixated on the management of COVID-19. That's what it's asked to do. and that's what it does very effectively. What it's not asked to do is to collate the evidence on the broader societal impact. Every pandemic is a societal pandemic as much as a biomedical pandemic. And the bit that we've not been nearly as good at is thinking about the societal impacts and the proportionality of the response to COVID-19.
But we were dealing with an emergency that we had to address, that people were going to die. The broader things presumably have come out. We've heard about cancers and health, and the government would say it's actually addressing that, and everyone must come forward to the doctor for any suspicious symptoms. People, they've set money aside for mental health problems. They're sort of doing their best, they might argue, and people are working on those collateral damage as well. How else could you what else could you do?
Suppose you imagine the situation where in 2012, 2013, we'd had a couple of cases of Ebola appear in the East End of London. And that would have been a challenge for COBRA, which is a committee of ministers, civil servants, and leading people from the various agencies involved. And you might have set up a group of scientists with specialist knowledge of Ebola to advise them on containing that outbreak, sort of there, then, and for a short period. Where that system has broken down is in moving on from the emergency response, we must do something right here, right now, to the long-term management and the analysis and understanding of which of our interventions actually work, what collateral damage is happening, what's the proportionality of being so focused on the challenge of COVID-19 that we exclude almost everything else.
Take two parts of that. One, which interventions, and you're talking the non-drug interventions, what's the upshot of not looking into those interventions and which work and which don't? And what's the upshot of not looking, horizon scanning for the very collateral damage that you're referring to? What do you think?
What we've seen is that lockdowns are a very blunt instrument. I mean, there's quite a raging debate about whether they do any good at all.
What's your view on that?
Well, I think it's still very uncertain because the quality of the evidence is really very poor, because we've not tried to collect it in the way that we have done brilliant work on the drug trials and on the vaccine trials.
Would it ever be justified again with a similar threat? And I know you have to assess the threat first. Do you think lockdown should be, we may well have another pandemic? Should we just now avoid such a measure?
Well, if we had a better understanding of which parts of the lockdown actually made a difference, then we would be better informed for dealing with the future virus, which of course is not necessarily going to present exactly the same pattern of risk as COVID-19. I mean, we started out with a pandemic influenza plan, which was not a bad place to start because influenza is also a respiratory virus. And many of the things that were likely to work against flu were also likely to work against COVID. As time passed, we realized the differences between the two viruses. Influenza, for example, small children are super spreaders, and it matters quite a lot to try to control the transmission from small children. We know pretty confidently with COVID that small children are not super spreaders in that same way. In fact, they don't seem to spread as much as adults do. And therefore, the sorts of things that we might have done for an influenza pandemic are not appropriate for a COVID pandemic. And, we can and we should have stopped doing them. We really should not have been trying to clamp down on the lives of our smallest children in the way that we have.
Why did we do that?
Well, I think partly because we didn't focus enough on investing in the social science research on the NPIs, the non-pharmaceutical interventions. Partly because every societal pandemic has three components. It's a pandemic of fear, and that fear is usually proportionate at the very beginning, but it can linger on and be amplified in ways that are not helpful. You have a pandemic of explanation, which is everybody trying to explain what's happening from their own point of view and with the interests of their own institution or their own scientific discipline. And you've got a pandemic of action, which is the demand that something be done. And it doesn't really matter what that something is, but governments clearly feel great pressure to be seen to act.
But should governments be running a response to a pandemic, or should it be for society to decide how we want to live and what risk we want to live with once we've understood the risk better? And that comes back to our earlier points about understanding what, how we measure the responses. But, once we get to a place, who should make those decisions? Because are you sort of inferring that some of the decisions have been political rather than following the science, whatever that means?
Well, I mean, ultimately, all of the decisions are political. The scientists don't make decisions; they give the best advice that they can, and the politicians either decide or they make a kind of non-decision. I mean, if a scientist walks in and says, "Do this," then it's entirely proper for a politician to say, "Is that the only thing that we can do?" The politicians should always interrogate scientists.
Do you think they have been critically assessing their advisors as they may have done had they been scientists?
Well, the questions that a politician would ask a scientist would always be balancing the kinds of issues that you were touching on a moment or two ago. And I think even within the science world, for 30 or 40 years, there's been a growing conviction that science is best used for the benefit of society in partnership with society, in collaboration, in a process of dialogue and engagement, and that people who are not scientists are not somehow irrational or stupid or ignorant or kind of blank slates that you just kind of go out there and inform and you say, okay, we're a kind of social elite. We've decided what's good for you. This is what we're going to do. And we've seen enough examples over the last 30, 40 years of attempts to do that, which have failed catastrophically.
Can you think of any example?
Well, I mean, the most obvious example, I suppose, which was very chastening in the biological sciences, was the whole issue around genetically modified food crops, which had many, many potential benefits for humanity, but which are still in Europe and to some extent in the UK and other parts of the world, fiercely resisted. Because in a sense the population have not seen and been invited to share in the benefits. It's only ever been seen as a way of increasing corporate profits rather than permitting better quality foods, allowing crops to be grown under more difficult conditions. And that was a big shock to the biological sciences. And I mean, I was quite actively involved for many years with the Biological Sciences Research Council in thinking about how to get better partnerships, better mutual understanding between the scientists in those spheres and the public more generally. And all of that learning, I mean, it was very important equivalents in the medical sphere as well. The great pressure from the National Institute for Health Research to engage patients and as experts by experience in all research projects, that this was likely to lead researchers to solutions that were more likely to be taken up by patients, that were better designed to meet the needs of patients. And all of that has really effectively gone out the window. The population become people to whom things are done rather than partners in the enterprise. Now, again, you can draw a contrast between last February, March. In emergencies, things get done differently. Although the research on natural disasters is again very clear that sustainable solutions to the sort of natural disasters we see in parts of the developing world rest on partnership between relief agencies and the people on the ground. The old thing about, we've come in with, a few million sacks of some food stuff from our donors, and here it is, guys. That's maybe the sort of thing you do in the first 48 hours. But when it comes to rebuilding, when it comes to developing long-term protection, long-term recovery, the people on the ground tend to know best. And the relief agencies rather painfully learn that lesson.
And how would that inform the way you would change things or do things differently, apart from looking at, do we know more about what we could ditch now and what we don't need now, and sort of moving us forward into the big June the 21st day? What are your thoughts about that? And sort of, I know it's sort of a big leap, but what do you feel about where we should be going really with this?
Well, part of the difficulty about having a sensible exit strategy is not understanding what you could safely dispose of very quickly, and what's worth keeping in the longer term. But clearly there has been this reliance on rules rather than on educating people in the principles behind the rules.
What do you think about that? Do you think people would have done what that, if you'd educated people and brought them along with you, perhaps as Sweden did? I'm not sure. Do you think that would have been effective, less, had less effect on people's mental well-being, as we've seen?
Well, again, it's a question of the knowledge that finds its way into the scientific advice network. I mean, if you talk to people in the field of regulation studies, socio-legal studies, studies in law, there's a great skepticism about the value of trying to organize many areas of social life by rules, because the rules don't fit the individual circumstances of people terribly well. They're at least kind of common denominator. And in some public areas, some areas of public life, then rules are important to make sure everybody's doing the same thing. When you come to things like, interpersonal behavior, social interaction, the sorts of everyday life situations that public health has been trying to control in order to manage transmission, you end up with rules that seem arbitrary, that don't fit very well onto the lives of the people who you're asking to abide by them.
For example, what? I know there was a funny thing in The Sun recently about not being able to kiss your as you get married, not being able to kiss the bride or something. But other things, you mean just not fitting very well in domestic life? Talk about that. I mean, as a sociologist, you'd understand this. There's people behind the numbers, and that's what you perhaps...
Oh, yes. Yeah. I mean, quite a good example actually is the contrast between what counts as a group in England and Scotland. And the Scots don't count children, so that actually makes quite a difference to the sorts of groups that can get together, particularly the sorts of family groups that can get together. I mean, I was watching something on the BBC News. I think it was a group of young women and their babies who gathered for exercises in a park in England, and there were sort of 6 of them and a leader, and that was probably breaking the rules anyway. And each of them had a baby in a pushchair in front of her. So actually, you had a group of 13. Now, it's possible it could have got defined in another way as a group of 15 engaged in some other kind of joint exercise activity. But in a sense, that's an example of a more or less spontaneous gathering that you've then got all these sort of problems about, well, is it in compliance with the rules or isn't it in compliance with the rules, rather than saying, actually, these people are keeping a bit of distance between themselves, they're doing something useful, they couldn't turn up and do this if they didn't bring their babies along, why are we making a big deal out of this? I was last summer with the beaches. You took pictures of Bournemouth Beach from one angle and it looked crowded. You took pictures of Bournemouth Beach from a drone and you saw that it was full of small groups who were really not interacting with each other.
And it is the
And
case that do you believe that transmission outdoors is negligible, or it's not something you should worry about? And in that sense, should we have been ordering people to stay at home so much?
there's a pretty strong consensus that the risks outdoors are minimal unless you happen to be in a very crowded area. I mean, I can think of some of the street markets in France that I've been in in the times when I've been allowed to go on holiday. Maybe the sort of pinch points in queuing for a football ground or something like that. But even there, you're talking about relatively low risk environments because, again, it's perhaps another gap. I mean, the Science Advice Network did eventually recruit engineers to advise it, but for a long time we had microbiologists pronouncing very confidently on what happened between humans.
That was your influence, wasn't it? I think you kind of stepped in over the 2 meter rule and quite instrumental in trying to question where's this 2 meters from, and talk us through a little bit about that, and what do we know now about our need to socially distance?
Well, the 2 meter rule was kind of a difficult area, and I think it quite nicely illustrates the preference that we've seen throughout the pandemic for believing the evidence of modeling rather than the evidence of the world. I mean, the Americans, the Centers for Disease Control, have now changed their advice to recommend 3 feet rather than 6, and 3 feet is roughly the distance that humans like to keep between themselves and people they don't know terribly well anyway. So that is not really a big deal. It's not a sort of artificial thing. But there's a lot of experimental work from laboratories that demonstrates that you can detect particles of virus over longer distances under very controlled and artificial conditions.
So what you're saying in the real world, it doesn't necessarily, the model world is different from the real world, and we can't put the two together and assume anything much.
Well, models are very helpful in asking sort of what if questions, in helping us to notice things about the world. We shouldn't ever treat them as predictions or crystal balls.
So, yeah, can we think of any examples where models have maybe been used and informed policy when perhaps they were too theoretical at that time and actually had more of an impact on our lives when, it was too early to really say? Do you think that's happened?
I try not to be too critical of modeling because there are some very smart people doing some very complicated things. And I think it's important to respect that. And, there's a lot of nonsense talked on Twitter and elsewhere. I mean, there's a lot of nonsense on Twitter anyway, but there's a lot of very unfair criticism of people like Neil Ferguson, who is a smart guy, but thinks in particular ways. But what we need to realize is that all models are only possible because they simplify the world. They make assumptions, they use what data that they can get hold of, and they put it together and say, if things work the way that we think they work, then this is what might happen. And the best models present a range of possible outcomes, what you might think of as a funnel of possible futures. If we start from here today, we might end up over here, or we might end up over there.
I was going to say, with our model now for the roadmap to what Boris calls freedom, and I believe, have you seen that? But anyway, there's a range of possibilities in there. Are there concerns about that?
If you look at that modelling that the government's relying on, most of that was done before we had really solid evidence of the impact of the vaccines. And it incorporates various assumptions about the uptake of vaccines and the effectiveness of the vaccines, which are really much more pessimistic than the real data.
Does it mean that we should keep adapting the models as we go along, or does it mean that we use them with less emphasis? Does it mean that we perhaps could be unlocking earlier? Are we looking at too pessimistic a model?
Well, if you look at the real data, it's pretty clear that it is running along somewhat ahead of the most optimistic end of the modeling range. If you look at the real data from the vaccines, it's running somewhat ahead of the most optimistic projections on the models. Now, models being complicated things, you can't update them every day, but you should be updating them pretty regularly. And you should be thinking, one of the things that, sociologists do modeling. I don't happen to be one of them, but we do them. But we also have a specialism, which I have been quite involved with, which is understanding how the data are produced. The data that go into models are human products. Somebody makes a decision to classify a patient admission to a hospital as a case of COVID or not a case of COVID. And everything else is built on that, and understanding how that decision is made. And it's often made by somebody pretty junior who's busy, who's in the middle of the night, who may have been told by their boss, if in doubt, do X or do Y. And all of that story about the data tends to get lost by the time it gets into a model. The modelers also have their own assumptions about how you link those pieces of data. And we know from, for example, the big data studies about the way in which discrimination gets built into artificial intelligence, because it just kind of collects the data and doesn't really look at what's going on, that you can end up with a selection of choices where the modelers are trying to play it safe. They're choosing to make conservative assumptions at every point in the process, which can then mean that the model ends up being excessively pessimistic.
I see.
And I think there are indications of that, throughout this, throughout the history of the pandemic. So I've really very little doubt that if you were focusing on the vaccines and the vaccination data, you probably would be moving faster on the removal of restrictions.
We've talked in the past about once you've vaccinated the at-risk groups. What would you be doing right now, and how would you be wanting to move forward? And would you have this June the 21st date set in stone, as it seems to be rather, and not before? There's a lot of that in there.
The June the 21st date is capable of being brought forward if there's a political will to do it. By the time you've completed the vaccinations of the first 9 priority groups, then you've removed 98% of the risk of death from the population. Yeah, that's talking about everybody getting their second jab, which will be, I suppose, roughly the end of April, early May. So you've taken out 98% of the risk of mortality. You've taken out 85% of the risk of serious infection that's going to be a challenge to the hospitals. So what you're left with is a relatively mild infection that will be comparable with the 30 or so other respiratory infections that humans suffer from.
But what about those people that didn't get vaccinated because they couldn't, because of autoimmune diseases, and people that didn't want to get vaccinated? And also, what about waiting to sort of see about transmission? There's a whole section of the population that will be vulnerable still.
Well, in terms of vulnerability, Lucy, you've got 4 groups. You've got the people who choose not to be vaccinated. And that's probably a relatively small number of people, but they are choosing to accept the risk. And, I think we just need to be clear about that the people who choose to accept the risk of not being vaccinated, cannot impose restriction. The rest of us cannot justify imposing restrictions, simply in order to protect them. You've got the people who haven't been reached by the vaccine.
Yeah.
And I think that is the big challenge to the local government and public health services over the next month.
What proportion is that? Is that quite a high number?
Well, it's not a high number, but it's a significant number. I mean, you are talking here largely about people in the most deprived communities, people in certain minority ethnic groups. But the evidence seems to be that if you get the vaccines to the people where they are in terms that they understand, and if we come back to this point about partnership, then people will happily be vaccinated. It's a nice story for journalists about anti-vax and vaccine resistance and all of this sort of stuff. The evidence is that actually it's relatively limited if you make it accessible and easy for people to get vaccinated. We've seen a big uptick in the vaccination rate among Bangladeshi communities, for example, over the last few weeks, in part because the local authorities with big Bangladeshi groups, populations, have been able to reach out to them and find out what works in terms of getting the vaccine to a place where people will have it.
So what's the problem?
We've got to learn from that.
But if that is true and we are reaching people and we have removed that level of mortality out of the data or out of the numbers by early May, what's holding us up?
Let me just complete the list of risk groups. There are the groups you mentioned, the people with autoimmune disorders, the people who are having immunotherapy for cancer treatments and so on. If you turn the clock back to 2019, you would always have advised those people to try to avoid infection and to avoid circumstances where they would get infected. And you would have had measures in place to support them. And then you've got a small proportion of people who do not get an effective immune response to the vaccines that are currently being used. And the evidence so far suggests that is actually a very small proportion of the people who receive the vaccine.
Are there any predicting factors? It's not just age.
Not that I'm aware of. Not that you would need to ask. You'd need to ask an immunologist about that. But in terms of the papers that I have seen, it's not possible to predict who those people might be. But it does appear that there are fewer of them than you would get with the flu vaccine in an average winter. So we are seeing a high degree of protection of individuals. We're also seeing quite a lot of blockage of transmission. Again, there's some uncertainty about the figures, and I wouldn't want to quote any to you, but there is definitely a significant effect. So we're reducing severity, we're reducing transmission. And that's what I mean by bringing the risk down to something comparable to the respiratory viruses that humans have lived with since forever.
And so we should live with that as we have lived with viruses, and we always have. What's your fear? Do you fear that these measures and controls will continue on to keep reducing the risk further and further down? And what is the potential damage of that?
Clearly, there are people who would like to try to suppress the circulation of the virus below what you might think of as its natural limits.
Why do people want to do that?
I think there are two motives for that. One part of it is the legacy of the climate of fear and the failure, if you like, to recalibrate the risk. So that, last March, it was, although the World Health Organization was saying as early as February 2020 that probably 85% of people who got COVID would never need to go near a hospital. Our television screens, our reporting was filled with these images of death and disaster. And that sort of message has been quite energetically sustained over the last 12 months.
Who do you think is to blame, if there is such a word to be used for that?
Well, as a sociologist, I'm reluctant to use the word blame.
Yes,
I mean, I think that
I can think of another one. Yeah.
No, I mean, if you read the research on media, you understand the dynamics of television, and having your journalists put on a lot of PPE and creep into intensive care units gives you great visuals. It's dramatic, it's exciting, it engages viewers. Whereas coming round to your house, Lucy, where you're coughing and spluttering a bit, and you've got a bad headache, and you feel pretty rough for a few days. Well, nobody's going to put that on the news at 10, are they?
No. I don't. But do you think that then we've terrorised the nation, and absolutely disproportionate to a disproportionate level in that sense?
Well, terrorizing, again, that's a sort of language of conspiracy, Lucy. I mean, I'm not sure that what we have here is anybody's intention, but it's certainly the outcome of the way in which a number of institutions work. It's come together to have that effect on the nation. And it will, I think, require some quite deliberate efforts to unwind that.
And is there any evidence that that's going on? Should the government now be trying to unwind it? Because there are people that haven't left the home. My neighbour is one, hasn't even been out the house for a year. There's lots of those. What do we do?
Yeah, well, you see, I think this was partly, it was maybe ill-timed, but I mean, it was partly the thrust behind the Eat Out to Help Out last summer. Now, I think that was perhaps not the best managed of schemes, but I think we may need some things of that kind. I think we could do with much clearer messaging about these are the small areas of social life in which there is a residual risk of infection that is noticeable. But for others, I think that we may, by the end of the summer, need to see some sort of campaigning about get out there and make the most of it, and thinking about how to achieve that.
If the population at large, and the Labour Party particularly, and large part of the Conservative Party are pro-lockdown, they want more restrictions, they're worried about variants, they're now worried about Europe. What's the political mileage in doing a campaign to release fear? And why are we continuing with this messaging if actually the risk is becoming as you say it is?
Well, I think this is where we come into the politics of it again, Lucy. I think that we are in a situation where we've almost got a kind of institutional paralysis. That we've had this pandemic of action. We don't know which bits of it have worked. We don't really know which bits of it are worth sustaining for a longer period, and which can be safely discarded, in part because there's been so little engagement of the social sciences throughout this episode. We cannot sustain the lockdown indefinitely without doing a great deal of damage to our society. That making people afraid of the world is devastating for social animals like human beings. I mean, it was why I was objecting to masks even before the evidence was clear that they brought very little benefit.
Is the evidence clear? I mean, there's plenty of studies that show they do reduce transmission. In lab studies have shown that, and using the right masks if people wear them properly. Is that clear?
Well, I think you said it yourself, Lucy. You're talking about lab studies, people wearing high particular quality masks, wearing them properly, um, and even under those conditions, the effects are modest. Well, the benefits of putting a bit of cotton around your face when you go to the supermarket, especially given that modern supermarkets are well ventilated environments, are probably barely noticeable.
What's
And
the damage? What's the harm of just putting something around your face? Do you think there is a harm?
well, this is what some of the public health people are saying, that actually it's all about the symbolic force, and reminding people that there's a pandemic on. And one of the things that sociologists know about is symbolism, and if the symbolism is be afraid every time you set foot outside your front door, be afraid every time you encounter another human being, make space, keep distance, minimize social interaction, stop doing all of the things that are really intrinsic to the functioning of any social group, since humans started forming them.
Do you believe that's why masks are being used? You don't believe they're being used to inhibit transmission?
I mean, clearly there are those who will argue that the weak evidence of a small benefit justifies the use of the mask. But alongside that, you've also got people who say, well, yes, we know they're rubbish, but we still think that people ought to be made to wear them because we want them to continue to be afraid of other people.
And you think that in a pandemic, that's not appropriate?
Well, you have the problem about how do we emerge from the pandemic.
Yeah.
Now, I mean, if we had decent evidence that masks were interrupting transmission, if we'd done, for example, randomized controlled trials in schools, which we could easily have done from last September, 10 big comprehensives where everybody, children and teachers, wear masks all the time, 10 big comprehensives where nobody wears masks ever, and see what happens to the infections. And we could easily have done it, and we chose not to. And
it worked when you've got the super spreading events, and we don't know what people are doing outside the realm of the classroom. I mean, it doesn't really matter for the purpose of this, but I just wondered if that would be methodologically flawed. You couldn't really measure. It's a difficult one to do, isn't it?
Randomized trials of social interventions are never easy.
Yeah.
On the other hand, if you have a big enough sample of schools, children, and teachers, then you can assume that those other events are happening randomly.
Yeah.
It's a reasonable assumption to make.
It's the so what thing. The kids can just put them on, that's it. And if it does some good and it saves a few people, that's worth it. What do you say in counter to that?
Well, firstly, of course, there are a lot of kids for whom the interruption of communication will be damaging to their education. There are the kids with communication difficulties. There are the kids with neurodiverse conditions. You've got a very significant chunk of any school that is that will be educationally disadvantaged by this. But you've also got the concern about what is the symbolic messaging here. And if it is, kids get a hard enough time in schools about school uniforms. I mean, you've got kids. You must know about this. You have the right skirt. You have the right shoes. You have the right. You don't have the jewelry. You have the right hairstyle. And now here's something else, and it's something that is deliberately there to create a barrier between you and your classmates, your teachers, to freeze those, to put a chill on those interactions that are fundamentally the way in which human beings learn from each other, collaborate with each other, cooperate with each other.
Would you like to see them just banned right now?
I mean, on the question of masks, Lucy, I think it is pretty clear that there are very few circumstances where you could argue that there is a a small but clear benefit. There might be things like rush hour on the London Tube as we used to know it, where you have intense crowding for short periods, for significant periods of time. If you're at a big football stadium and you're going through a narrow passageway between the outdoors where you are queuing to get in and the indoors where you're going to be sitting in a stand seat, then the transience of that, the shortness of the exposure, means it's pretty unlikely that you're going to pick up an infection. Once you get into the stadium, there are probably good reasons for insisting that people remain in their seats, and that which will be unpopular with a lot of football fans. But the seating provides a natural social distancing. You don't, on the whole, breathe over the people next to you, sitting next to you. And if you're shouting and cheering and you're sitting down, you're doing that over the head of the person in front. And the air currents around will be tending to carry any particles up and away, rather than into places where anybody else is going to breathe them. So it's I know it's really getting down to a level of detail, but that's what I mean about talking about, if you like, risk assessments rather than rules, and understanding the principles and understanding what the real life situations are, and thinking, what do we do about these?
What do you worry that we may see, what we walk into? It's not going to be, oh, well, that's over. The bomb's gone off. We hid in the bunkers and now we're out. What do you fear might be the new landscape? Will it be a continuation of these measures, which, as you say, we don't have evidence for? And what would you like to see?
Well, what I see is this entrenching of things like face coverings, physical distancing, aggressive testing, the use of of immunity documents to access jobs, public buildings, international travel. I mean, again, it's this failure to recognise what the vaccine does is to protect you. So knowing about anybody else's status is irrelevant. Once you're vaccinated, this is giving you a very high degree of protection against being sick enough to need to go to hospital. And even if you do need to go to hospital, the likelihood of you dying after you get there, all of those become reduced to.
We've already talked about it blocking transmission. Once you've been vaccinated, you're part of the group that is potentially less risk to other people. What are your concerns about vaccine immunity passports?
Well, the way in which they become exclusionary documents that that the people who can't be vaccinated won't have access to them.
You mean the people who have cancer or immunocompromised?
Yes, and pregnant women.
Gosh, I'm going to ask you this actually. Has it taken its toll on you that you've been constantly not constantly, rung by a lot of journalists? You've been on various government advisory panels and you've had to keep up with it, up to speed. People ring you as if you are like an encyclopedia, your knowledge. But is it, you were meant to be going into retirement, I think you said, and this must have been hard, actually.
Yeah, I mean, it's certainly not how I had planned to spend the last 15 months. I was 70 last August. I had some significant surgery in June 2019. And I'd sort of certainly had personal plans to, I suppose, run out the various promises that I'd made to write things with some of my former students. I've got an outstanding book contract on health and medicine in Burkina Faso in West Africa. And that's really what I'd intended to do, and put myself in a position to spend a bit more time with my small grandchildren and with my garden and various other hobbies.
Why have you done this? You've given a lot, to helping people.
Well, I suppose goes back to attending the sort of school that used to prepare junior officers to lead the troops over the top of the trenches in World War One. That there is something about there's something about a duty, a sense of public duty, that if people are asking for your services in a national emergency, you don't just say, well, frankly, I've given up, and I'd rather sort of sit in my garden and sort of drink cocktails. And so some part of it is about the social responsibility of a scientist. That if you're saying things, if you're able, as those of us who study the sociology of science and technology are often in a position to do, to act as an interpreter or a mediator between the public and the science, and you do your best to get it right, and you try to indicate the limits of your own knowledge.
Do you think your independence from sort of funding and other interests has helped you see things in a different way, or perhaps without conflict? Do you think that has an impact on sometimes in the sciences?
Well, we all have our conflicts of interest. I mean, so sociology is about trying to be honest about them, but there's no doubt that a sort of old-fashioned final salary pension does give you a great deal of intellectual independence. I'm not really dependent on anybody's favour for getting a grant or getting a promotion. That is very liberating in a way. I mean, it's also a bit of a constraint, because whereas a lot of the other people in this space have research groups behind them, sort of armies of postdoctoral research fellows or postgraduate students who can sort of help with the sort of briefing and the searching and the sort of background work of putting things together. I'm very much somebody who's sort of working on their own with very little in the way of institutional resource.
Has that been hard? Has it been wearing?
Well, yes. I mean, it is a physical stress, although I'm not sure how different it is from the experience of the whole nation. I mean, I think I've said to you before, Lucy, that as a nation, we're all under stress. We're all of us having our sleep disrupted. We're all of us sort of feeling that pressure.
But you can't just switch off and forget. People often tell me, well, you need to just forget about it and stop watching the news. And obviously, I shouldn't be doing that. I hope I don't do that in my job. But same with you. I get my information from, and lots of people do get their information from you. You have to keep abreast of everything. So you haven't got, if you feel that sense of duty, it's almost like, well, you can't just stop.
There are moments when a lot of people in this country, sociology, it's not a very valued discipline.
Why not?
Oh, well, that would be a much longer story. That would be another podcast altogether, Lucy.
The value of sociology to the lockdown and the pandemic and the measures that we have is that it helps us understand the people behind the numbers and lots of other things, and understand our own biases. That's what you've said before. Is that where you'd be?
Yeah.
And last question, because I know it's run over a lot, but I'm just want to bring you back. I know you said something on radio recently about June the 21st and how your fears are what people may see as temporary measures, and we just do this for a little bit longer and a little bit longer. So the immunity passports, the masks, the social distancing, it could just go on ad infinitum. There is no end point. And we may indeed lock down again in winter if hospitals get overwhelmed. Is that something you fear, and is that something you want to prevent, or what do you feel?
Well, I mean, I would be very unhappy if the country got locked down to protect the hospitals in winter, because I would regard that as evidence of poor planning on the part of the health service. Because if we don't need 30,000 beds in January for COVID, there's a good chance we'll need 30,000 beds in January for flu.
But there may be new variants and other things that increase stability.
This is perhaps pushing at the boundaries of what a sociologist should say about virology. But from the papers that I'm seeing, it does seem that there are a limited number of ways in which variants can act on the particular spike protein, and that the vaccines continue to be effective in mitigating against severe infection. This is probably because of the way in which they stimulate the T cells rather than the antibodies. So the T cells are the second line of defense, if you like, in the immune system.
Yeah.
Yes. And they take a bit longer to come into play, but they act across a much broader range of challenges. So that although the variants may not get the immediate response from the antibodies, they still run up against a pretty solid degree of protection from the T cells.
So are we over worrying about them? Should we be shutting our borders in the way that we are?
Again, it's the pandemic of action. Shutting borders looks like an easy thing to do. It doesn't keep variants out. They're just as likely to arise in Burnley as they are in Benidorm. They get into the country one way or another eventually anyhow.
This is possibly doing more harm than good.
It is. I mean, Andrew Pollard, who's was the sort of one of the leaders of the vaccine development at Oxford, said, look, he thinks we're making far too much fuss about each of these new variants as they emerge. We need to look.
Why is that? Is that because the modelling suggests that they could be more dangerous because they're not looking at T cells, or is it because we have fear of uncertainty?
Well, it is the uncertainty. It's a new thing to that prolongs the uncertainty, prolongs the anxiety and the fear. But I think there is a difference between having a system of surveillance that allows us to pick these things up and have a careful look at them, while recognizing that they are unlikely to be a real problem. And I think we've seen that now, certainly with the Kent variant. I mean, the latest publication from Public Health England makes it clear that it doesn't have the impact on mortality that the models that have been previously published predicted.
Right.
When you actually look at the real world experience, people do end up in hospital rather more frequently, but they tend not to die once they get there.
Right.
So I think we're learning more, we're fine tuning our understanding, but we can't live in a world where we are constantly shutting things down because some new variant has appeared, when most of the variants are, if you like, just variations on other variants.
So in that sense then, the June the 21st date, what would you like to see, and what would you like to, what measures would you like to stay in place, and what measures would you like to have removed?
Well, I find it very hard to see the justification for any restrictions, controls, or other interventions after June the 21st.
Well, anything.
Well, can I come to that?
You can, please do, and I will end it in a minute. But yeah, no.
I would certainly get rid of any mandates for face coverings. I mean, if people want to continue wearing them, fine, but let's not make them wear them. Let's scrap this idea of immunity documents, except if foreign governments take a different view and we have to come up with something to enable people to travel internationally.
Because of the discrimination?
I mean, what you end up with, it's very typical of short-term measures, that they tend to become long-term and they tend to get other things laid on them. Governments look at them and say, oh, wouldn't it be a good idea if we did X as well? And isn't it really interesting that we can track how many times you go to the pub, Lucy? Because, those data have been picked up by the system. And perhaps we'll send you a text, Lucy, to say, you've been to the pub 4 times this week and that's not good for you. And perhaps you should only go twice. And by the way, how much are you drinking when you get there? And who are you interacting with? I mean, these things very easily escalate. I mean, I've drawn the parallel with airport security since 9/11 and all the interests that get involved in that. And we need to cut that off at source, because otherwise we will have so many commercial interests and so many labour interests in the employment that is generated. The same with test and trace. We need a good surveillance system, which we can do by building on the Office of National Statistics survey or the Zoe symptom map with genomic testing. It would be a very good idea if the nation washed its hands a bit more often, but not necessarily as obsessively. It would be a good idea if we managed to keep some of our buildings, workspaces, and toilets a bit cleaner than we do. And that, both of those are worthwhile legacies, but that's more as a sort of general benefit for infection.
The test and trace, you don't think we should have this sort of lateral flow and the testing in schools and testing in workplaces? You wouldn't want to see that?
Well, again, you have to say, what is the point in a vaccinated population?
So that's it. June the 21st must mean June the 21st, with a few things as a legacy, but not continuing all these measures. And perhaps, do you fear that the measures will stay in place? The government has invested so much into it.
I think there's a lot to fear, and I think that's why I'm here, and why I think it's important to continue challenging that assumption that these things will continue, and to challenge the image that June the 21st is this great day of liberation, which on present plans it won't be. And we come back, and this is perhaps the final thing to say, that we should be setting as a benchmark the question, would we be doing this stuff for any of the other respiratory viruses that humanity lives with? And if we wouldn't be doing it for influenza in particular, why are we doing it for COVID? And if we haven't got a good answer to that question, then we shouldn't be doing it.
I'm just, that lots of doctors have said how wonderful the year's been, and they've had less flu in children who do or are susceptible to dying from it. And I know individual people who've said they've had a fantastic year and not had any bugs. So maybe we should be thinking about distancing and masks to stop viruses, to live a more healthy, disease-free life.
Well, the thing to remember about the respiratory viruses that we've always lived with is that we've got immune systems that are used to dealing with them through periodic reinfection, periodic reactivation. And that's really important, because most of them evolve a bit. Flu evolves quite a lot. And I think there's a real danger that if the human immune system is not regularly challenged by these viruses, then it will gradually wane and decay. And we will at some point encounter a variant to which we have no effective resistance. And I think the thing about flu in particular is flu is not something we can eradicate, because we share flu viruses with pigs and with birds. And it doesn't take a lot to imagine the truly devastating consequences of, let's say, a pig virus crossing into the human population, a pig influenza virus, to which the human population has very little resistance. In addition, you need to think about some of the things we've already touched on about what masks do to human interactions and to human society. We want people to interact. That's the sort of beings that we are. And that face-to-face interaction, that co-presence, not a virtual presence, a literal physical presence, is really important in the way in which in the dynamics of society, the way in which we make things happen, and we make new things happen. And Dan, our recordist, will tell you about his singing career. Music happens because people come together, And new music happens because those people come together and they find their audience. And it's that sort of mutual development. Now, that's a very small example of the creative processes, the innovative processes, the new things that happen only when people get together. And if that stops happening, then we just stagnate as a society. Gradually humanity runs out of steam. We can live on the relationship capital that we've accumulated for a certain period of time. But as we become dispersed, as we become fragmented, as we all sit in our homes because we're too scared to go out, all of those things gradually die. They don't get renewed. And so, although it may be nice for doctors not to have to do so much work, and it might be that we see fewer deaths from some things that doctors might think of as avoidable or preventable, they come at a great cost in the world that we live in and in the future of humanity. And as a sociologist, those are things that that I learn about and I think about, and those are things that concern me. They're not vague and they're not intangible. They're about our prosperity. They're about our quality of life. They're about what it means to be human.
Brilliant. Just rolled over. That's amazing. Absolutely brilliant. I'm really chilled. And thank you so much. I'll let you have a break.
Okay.
Don't go near the phone and I'll try not to ring you. Thank you so much.